welcome to our webinar today. My name is Jessica Pierce. I am a senior site manager at the National Council of Juvenile and Family Court Judges, and we're really thrilled to have you here with us. I do want to let you know that our webinar is grant funded. We are funded by the State Justice Institute, and so any points of view today are going to be those of the presenters and do not represent any official position of the State Justice Institute or the federal government. So I want to tell you a tiny bit about the National Council of Juvenile and Family Court Judges. We are co-sponsoring this webinar along with our partners at the Council for State Governments. The National Council of Juvenile and Family Court Judges is the oldest judicial membership organization in the country. Josh, if you could go to the next slide. We have over 30,000 judges and other professionals that we serve every year with webinars like this, with technical assistance in your own jurisdictions, with trainings across the country, with national conferences. We really want to help make sure that we are having an impact in communities and helping courts serve the youth and families that they work with. Let's go on to the next one. We have 4 core values at NCJFCJ: compassion, leadership, education, and community. And these are both for the staff at NCJFCJ and for all of our member judges. We use these 4 guiding principles to help drive all of the work that we do. And I'll turn it now over to you, Josh, to talk about CSG.
Thanks, Jessica. Good afternoon, everyone, and thanks for joining. I'm Josh Weber. I oversee the Youth and Juvenile Justice Program at the Council of State Governments Justice Center. If you're not familiar with us, we are a national nonprofit, nonpartisan organization that works across all branches of state government, as well as with local government, to help improve outcomes for youth and adults in the justice system through evidence-based, consensus-based strategies. We've helped improve outcomes for millions of youth and families in contact with the juvenile justice system and have had the opportunity to conduct systemic reform work in most states all across the country. As part of our work, we also respond to emerging issues and challenges in the field and conduct original research, 50-state best practice reviews, and promote innovations, tools, and resources to help jurisdictions across the country improve public safety and youth outcomes through research-based approaches. The focus of this webinar is on research-based strategies to improve public safety and outcomes for higher risk youth. And so before I turn it over to our 2 expert presenters, we thought it is important to ground the conversation in what the data shows actually is happening around youth crime and youth violence. As many of you are probably experiencing in your jurisdictions, there is more concern around youth crime and youth violence amongst policymakers, system stakeholders, and the public than there has been since the mid-90s. So quickly, to ground the conversation in data, I want to share with you, based on the most recent data analysis possible that we conducted, what's been happening with youth violence. The first key takeaway is that actually arrests for youth violence declined 54% over the last 22 years. And in 2022, which is the year that we have the most updated data available from OJJDP and the FBI, arrests for youth violence still remain near historical lows. You can see that other than the artificial lows of the pandemic during 2020, youth arrests for violence index offenses, which includes rape, robbery, homicide, and aggravated assault, were at their lowest level in 22 years. At the same time, what did change is that youth arrests for homicides have increased for the last decade, and in 2022, coming out of the pandemic, surged to never before seen levels. So arrests for youth violence overall down, but arrests for the most serious form of youth violence, homicides, have been on the rise and spiked in 2022. Most of those homicides were a result of gun offenses. And you can see from this chart that arrests for weapons offenses, while having declined for the last 10 or 15 years, also spiked post-pandemic. As a result, homicide and suicide are now the leading cause of death among children and young adults, particularly for youth of color, ages 15 to 19. In half of all cases in which a young person committed a violent offense, the victim was also a minor. And so much of this homicide and gun violence is peer-to-peer violence. And it disproportionately impacts youth of color. The rate of firearm death among Black youth in particular is 20 times higher than white youth. And the rate of gun violence victimization for Black youth in rural areas is now equal to urban areas. So this is no longer just a big city challenge. But it's also important to note that the most recent data that we have available from the FBI, recently the FBI released their 2023 data. 2024 data is still provisional. The FBI is not yet able to break that data out by youth and adults. But what that data shows is just as the violent crime rate and the murder rate in particular spiked post-pandemic, over the last 2 years, those rates have also declined by historically large levels. And so while any young person committing a violent offense, and particularly a homicide, is one too many, what these data slides in totality show is there has not been a significant sea change in youth crime or youth violence over the last couple of years. There was a post-pandemic spike, and now we see violence and homicides in particular returning to post-pandemic levels. And that's important because, as may be the case in many of your jurisdictions, states and counties are increasingly responding to concerns around youth crime and violence with tough on crime approaches that are not necessarily based on research or don't address the root causes of these challenges. And so we're grateful to have two experts with us today to really help us understand from decades of research and best practices in states what really does work to improve outcomes for the highest risk youth and what research should jurisdictions be relying on. And so I'm happy to be joined by two presenters. The first is Dr. Gina Vincent, who is a professor of psychiatry and co-director of the Law and Psychiatry program at the University of Massachusetts Chan Medical School. She is also the president of the National Youth Screening and Assessment Partners, through which she has provided technical assistance and training to dozens of jurisdictions across the country. Dr. Vincent is the foremost national expert on risk and needs assessments for justice-involved youth. We're also joined by the Honorable Troy Braswell, who is a circuit court judge for the 20th Circuit in Arkansas, where he has served for the last decade. Before his judicial service, he was chief deputy prosecuting attorney for the 20th Judicial District. Judge Braswell helped lead Arkansas's adoption of the Savory Risks and Needs Assessment, and as he will explain, his district has achieved significant improvements in public safety and youth outcomes as a result of his outstanding leadership. Gina, we'd love to start with you and to hear more about what research says works with high-risk youth.
Thank you, Josh. I'm delighted to be here. Thank you all for coming today. It's wonderful to be here presenting with some of my favorite people who are very esteemed colleagues as well. So it's hard to talk about what to do with high-risk youth and how do we manage high-risk youth and how do we prevent them from having or engaging in further violence without also talking about what we do with low-risk youth and how we identify high-risk youth and separate them from low-risk youth. So my goal today is to cover 3 topics in this brief conversation. I'm going to talk about risk needs assessment and risk need responsivity and how we use that to manage youth and reduce their violence in the future. Then I'm going to talk about how do we implement this approach, what has worked around implementation, and then I will basically set up the Honorable Judge Braswell to talk about by talking about the successes that they've had in Faulkner County. We have had the pleasure, my team has had the pleasure of conducting quasi-experimental studies with many jurisdictions when they're implementing risk assessment and risk need responsivity. We have a lot of data about what works and what doesn't, and so I'm going to be presenting some of that information today. So first of all, and I imagine many of you who are on the webinar have heard this because this recommendation came out quite a while ago now. It still stands. The recommendation that that the juvenile justice system use structured risk and need assessment instruments to identify low-risk youth who can be handled less formally in community-based settings, match youth with specialized treatment, and to target the more intensive and expensive interventions towards high-risk youth. That recommendation has been around for a while because this is still what the majority of the research is showing works. The key word here is use. So at this point, certainly since 2013, I would say just about every jurisdiction in this country has some kind of risk needs assessment that they're using to help them make decisions and help them do case planning in some form or another. Most have adopted it. However, there's wide variability across jurisdictions in how well they're actually using these tools and whether they're using them to their maximum benefit. This is basically outlining risk need responsivity. There's a few details about youth and youth offending that are important to discuss before we get into what to do with a higher risk youth. So first of all, we know some offending is near normative behavior during adolescence. That's been shown in epidemiological studies. I also think it's very important to point out that the majority of youth referred to juvenile courts are not high risk. They're low risk. And so the data that I'm showing here is based on data from 8 states where we have helped them implement valid risk needs assessment instruments to determine who's high versus low risk. The low-risk youth are making up 40 to 50% of referrals to juvenile justice, okay? The only time I see that being much lower is if the risk assessment isn't done until after adjudication or after disposition. And even at that point, we're not seeing this get below 30%. The high-risk youth can range anywhere, we've seen range anywhere from 7 to 23% of all youth referred to the court. 7% because when you're looking at all youth referrals, the 23% you might be more likely to see if you're doing your risk assessment post-adjudication. This is the minority. So I think that's important for us to keep in mind. Next, we know, and this has been studied ad nauseum, we know that one-size-fits-all responses and services do not significantly reduce recidivism. If we take all these youth who get referred to the court and have them do the time for the crime without sorting them based on risk level and what actually brought them to us to begin with, we don't have good outcomes. In fact, we increase the likelihood that youth are going to end up in the adult system. We know most low-risk youth, by definition, are not ever going to commit another offense. In fact, in the majority of our studies, when we look at valid risk assessment instruments to identify who's low risk, about 5% of those kids actually recidivate. We're not going to budge that. So giving them a lot of services, keeping them in our courts, keeping them in the system is not cost effective. Some studies have found that it's actually been done more harm to these youth as well. And then we see increased probation violations, we see deeper system involvement in those cases, and we're not seeing reductions in recidivism because they hardly recidivate to begin with. All right, so lastly, we know risk is very malleable during adolescence. This is a wonderful time where we have a lot of ability to help youth get better. Right, so it's very malleable. What I'm showing you here is a graph from the Pathways to Desistance study, which studied youth and young adults who committed felony offenses. So these are kind of considered the more serious individuals. And even among them, the majority either did not have much of an offending track record over time or over their life. I think the study went out for 7 years, or desisted. So as we see, these last 3 lines, 2 of them, the bottom 3 lines, 2 of them, those youth are hardly offended again. The middle line, that's 17% of kids, kept a low, steady offending rate. And then we see the majority of kids who started out high in their offending or their violence rates, the majority of them desisted pretty fast. So we're really talking here about a small percentage of youth that we need to be most concerned about. Now, we can't tell these 2 groups apart very well, the desisters and the what you might call the chronic offenders, whatever term you want to use. We can't tell them apart very well initially, unless we do a good risk assessment and we monitor them over time. All right, so how do we identify high-risk youth? Well, can we do this based on the presenting offense? That's kind of how the court system works, right? We're determining who's high risk based on the offense that they committed. That's not a great strategy for a few reasons. Obviously, that's not going to go away. Obviously, there's mandates, there's some policies about how youth are getting disposed or handled based on their offense. But I do want to make the point that you can have two youth come to you for the same charge, let's say aggravated assault, same offense. One of them, but they get there from very different pathways. So one may have been the youth who has been bullying kids ever since elementary school and just now finally got charged with something serious. The other one could be a youth who's been a victim of bullying since elementary school and finally had it and snapped and got charged with a serious offense, first offense. These youth have very different needs. They're going to need different supports and they're going to need different kinds of management in order to help prevent them from committing violence again. And obviously the one who was the victim most of their life has a much better prognosis than the one that was the bully. So this is why the offense alone does not give us a lot of information. There are several risk need assessment instruments out there that have been validated for this purpose. They can help answer the question, who do I need to be most concerned about? So who's highest risk versus low risk? And then also give some guidance around the what should I do about it? And the what should I do about it, I think, is why many of you are here. We have valid identification with these instruments, and these instruments can help us to determine what's likely driving that individual's behavior. Now, we've known for a long time what are the primary risk factors that get people in trouble. However, among these risk factors, some are still more important than others. So these all may be associated to some extent with recidivism, but some are more important than others when it comes to predicting who's likely to engage in violent recidivism. Disruptive behavior problems, which you may see under many different names, depending on a risk assessment tool. It could be called aggression and violence. It could be called personality behavior. I don't like using the word personality when we're talking about adolescents. I prefer the term disruptive behavior problems, but you may see this coined differently depending on what instrument your jurisdiction uses. Attitudes condoning violence, obviously a big one. If they don't see any problem with being violent or engaging in violence to resolve conflict, they're not going to stop unless we give them a reason not to, right? Or unless we help them change the way they think. Delinquent peers that are also getting in trouble with law, and family. And what we're interested in the family situation is largely about parental monitoring, supervision. Is it consistent? Is it appropriate? All right. It's not about the structure of the family. It's about how much supervision and support is the youth getting there. This is hot off the press information, and I want to just encourage people that this came from the Youth Protective Factor Study. We have a brief online. There's a website to it. What I'm showing you today is based on, what a lot of science has told us, but also more recently, we looked specifically at violent recidivism over the span of 3 years after juvenile justice involvement. And these are the factors that were most predictive. Okay, so those are the ones we want to be most concerned about. High-risk youth, and we want to be most concerned about those risk factors when we're talking about our management approach. Risk need responsivity. This is still the evidence-based approach. Some people have some jurisdictions have had a lot of challenges implementing it. I am going to talk about how to do implementation well, and Judge Braswell will be following up on that too. So I'm going to hit each principle here one at a time. The risk principle tells us we want to match the intensity of our intervention, whatever that intervention may be. More serious disposition, higher level of supervision, more services, whatever that may be. We want to do more of it with a higher risk youth. The high risk youth are the ones who need our attention. Now, the risk principle also tells us we want to do as little as possible with a low risk youth. And I already talked about how we're not getting much return on investment when we are monitoring or supervising low risk youth in the juvenile justice system. Some of these are going to slip through the cracks because they also tend to be the ones who commit sex offenses sometimes, or the youth that get charged with sex offenses tend to be lower risk based on our kinds of risk assessment instruments. They're going to get in there, but they need very different kinds of services. Okay, Do as little as possible, handle them informally if at all possible. Most of your low-risk youth. Moderate risk youth, that means we do have some concern. They could be violent in the future. We need to give them services that are going to address their specific risk factors, and we need to do some monitoring of those youth. The high-risk youth need the most intensive risk management. That doesn't mean they need to be confined or incarcerated or put in a placement in order to manage their risk and in order to decrease their likelihood of being violent in the future. What it means from a risk need responsivity framework is that we want to see if the risk factors this youth is presenting with can be managed in the community. Do you have the services needed to manage that in your community? If not, you might be considering a shorter term placement. Can you put a disposition in place that makes that placement short term so they can be reassessed, reevaluated for when they're ready to reenter, right? When we put risk assessment instruments in place and have done this level of education with the judiciary, we see among the youth who are identified as high risk predisposition, still the majority of them get served in the community safely. Okay, so this is a very important point, that high risk does not equate to needing to be locked up. Some will, some may need to be, but ideally for a shorter period as possible so that you can reevaluate whether that is still needed, because youth improve. Need principle, that's second. What the need principle tells us is we want to target those dynamic changeable risk factors, which I showed you earlier, and ideally only those risk factors. So this kind of is what to do. I'm going to show you data because this graph it presents this very nicely. It's from one study, but there have been several studies that have shown this. We want to match the used dynamic risk to services in the community, ideally, to individualize case planning or risk management. All right. So what this graph is showing you are the recidivism rates of youth on probation in one particular probation office based on whether they got services that addressed their need or they didn't, or addressed their risk factor or they didn't. So take, for example, the family area there. The darker bar is showing you the recidivism rates for kids who had family as one of their pressing driving risk factors that got them here to begin with, and yet they didn't get a service to address that the whole time they were on probation, and you can see their recidivism rates are around 70%. Compare that to the kids who did get a service whose recidivism rates were considerably lower than that. If you look across the board here, the ones with the highest recidivism rates when we don't address it are those personality behavior characteristics that I like to refer to as disruptive behavioral problems. These are going to be your things like outside of the norm impulsivity, risk-taking, daring behavior, attention problems, potentially callous unemotional traits, or lacking empathy or remorse. And I'm talking about that as a trait. Okay, you don't see a lot of those kids. When you do see them, we do need to be concerned. Anger management difficulties, self-regulation difficulties, that's these kids. This is the hardest risk factor to see because it's not tangible, requires an assessment more often than not, because we're not all going to have the same opinion about who has this and who doesn't without an assessment. And this is the area that is most strongly related to recidivism, violent recidivism in particular, long-term. And it's the area that we see getting underserviced the most often in the jurisdictions in which we work, right? So I can't stress enough that this area is really important if the youth is presenting with it. Lastly, the responsivity principle. This one is a little harder to implement because there's no clear instruction guide about how to do this, all right? It requires, this is the art of case planning or the art of risk management. And basically it's saying you want to tailor services to what youth are going to respond to best. And you need to consider some youth characteristics when you do that, like their language, their gender, or sex, their culture. Do they have transportation? Can they get there? Do they have a family that can take them there? And so on and so forth. This is the how to do it. One of the biggest issues that comes up in this domain or in this principle is mental health. All right, I'm going to take a minute to talk about mental health because it's really important. So kids who are presenting with mental health concerns, That may be a responsivity factor. It's not a risk factor. Okay. In big groups of data, there have been lots of studies about the association between mental illness and violence. And a large white paper came out summarizing that decade of research recently and told us that only 12% of violence in our community, only 12% of violence in our community is attributable to major mental illness. The majority of violence that we see in our community is attributable to the risk factors that I just presented to you earlier, right? It's not mental illness. One exception is first episode psychosis, which is something we're all more likely to deal with on the juvenile justice side, obviously, than they are going to be dealing with in the adult side, all right? Since the age of onset tends to be in our wheelhouse here. So first episode psychosis can lead to violence, but in general, mental illness does not lead to violence. That said, there are many mental health diagnoses such as bipolar, certainly schizophrenia, certainly hypomania, something of that nature that can underlie and drive up, spike up some of those other risk factors I talked about. So if you have youth with mental health concerns, significant mental health concerns, they may be a little higher risk because they have these other risk factors too. They tend to be largely hanging in that moderate risk group in our studies. They're not tending to be in the high risk group. We also know that treating risk factors, the ones that I showed you before, reduce violence and reduce recidivism. Treating mental health alone does not. I want to repeat that again. Mental health services are not reducing violence. This is still in all the jurisdictions in which we have worked, except for Judge Faulkner's. I almost called him Dr. Faulkner, but instead of Judge Faulkner's, as he's going to talk about, in all the jurisdictions in which we've worked, especially most recently, this is the #1 service kids are getting when they're involved in juvenile justice is mental health counseling. Okay. Why? There's 3 potential reasons. One, it could be because we're seeing even more youth with mental health concerns since the pandemic ending up in the juvenile justice system because there isn't another system to deal with it. They don't know how to deal with it and they're sticking them here. That could be one. The other is what we've heard from a lot of line staff and judges is the mental health services are all you've got in your community. And so that's what you're giving them because you don't want to just give them nothing. That's a problem, obviously, where we need to work on improving our resources. Lastly, I think there is a misperception. I think there is still a misperception among probation officers, attorneys, judges, whoever is working in the system, that mental health counseling is addressing those disruptive behavioral problems that I was talking about. That is rarely the case. Okay, so that's not the answer. What is the answer? I want to stay here for just a second. We did an environmental scan recently of all research up through the end of 2023 to look for what is most effective when it comes to reducing violence among adolescents and young adults. This is not going to be shocking because this information hasn't changed over the last many years. It's going to be cognitive behavioral therapy-based approaches, multi-systemic therapy, multidimensional family therapy, and functional family therapy. And all of those are CBT-based. Second in line, Big Brothers and Big Sisters has got good evidence for reducing violence if what youth are coming in with is that peer issue or family issue. Okay. Parenting with Love and Limits is another. And lastly, DBT has some evidence for also helping, right? So that's what to do instead of mental health counseling. All right, I'm going to talk a minute about how do you implement all this? This sounds like a lot. How do you implement it? We have a guidebook. This is still a great resource. It's available on our website. You can download it. That outlines 8 steps. And some of the most critical ones are getting buy-in from all your partners and the appropriate parties from the beginning. That's the probation office, that's the judge, that's the DA and the defense, and your providers. Select whatever risk needs assessment instrument you're going to use. Select that together so everybody agrees this is the way to go. You're going to have more buy-in and less people saying they hate it, okay? Because that does happen when they weren't involved in the decision. Developing policies and procedures to make sure that instrument is used at every level of the system in which it can be helpful. And what we've learned is these three areas, if the judiciary is not involved in these three steps, we tend not to see very good outcomes. Okay, so it's critically important to the point where our team doesn't work with jurisdictions anymore to adopt or implement risk need responsivity unless the bench is on board. All right. Then there's training the staff how to do all of this, pilot testing and so on and so forth, and data tracking. All right. Ideally, you want to implement that risk needs assessment instrument as early in the process as possible. That's what's going to help you decide which kids could be diverted. If you implement it pre-adjudication, it's obviously critically important there are MOUs or some kind of legislation in place to protect use of this information in adjudication decisions. Okay. If you can't implement it pre-adjudication so that it gets to the bench before the bench is making their decision, we suggest implementing it pre-disposition. That's a little harder because that means judges or the courts and the attorneys allowing time for that assessment to be done in between those hearings. So it means bifurcating hearings, which is harder for people to pull off. All right. NCJFCJ, who is hosting this webinar, came out with this terrific resolution many years ago. I highly recommend it, where they talked about making juvenile probation in line with adolescent development. It talks about recommending use of valid risk needs assessment instruments for dispositional planning and decisions. It talks about emphasizing individualized case management to provide youth with services that are going to address their dynamic risk factors. And it talks about ceasing to impose conditions of probation and instead allowing probation departments to develop case plans and risk management plans with families. Okay. I'm going to just quickly show you what happens when we implement things well, and then I'm going to get to Faulkner County, and then I'm going to hand it off to Judge Braswell. So we have tested this manual. I'm going to show you this again. We've tested this manual in 6 states, multiple jurisdictions in 6 states at this point. Every state had positive outcomes in at least some areas, except one jurisdiction in one state. And I'm going to explain why that is. And they're going to remain anonymous, obviously. So I'm going to show you some examples here of what we found. These are different states, okay? So the first one implemented their risk assessment pre-adjudication. Judge had an MOU in place, so they weren't using that information for adjudication decisions. As you see, they had and this is a well-designed study, quasi-experimental, kids who were processed in that court the year before the instrument was put in place versus the kids who were processed in that court the year after making them apple to apples comparisons by doing all the statistical controls. Significant reductions in the number of youth who ended up on probation and significant increases in kids who were just dismissed because they realized many of the kids referred to them were low risk and didn't need their involvement. Okay. Here's another court that did it post-adjudication predisposition. They had, and because they did it post-adjudication, we're not going to see an increase in diversion in this place. But what we did see is they cut their placements and their detentions in half when they put this in place. That's a big deal. And in these courts, there was no increase in recidivism in either place. So kids were getting seen less. They weren't having as much system involvement. Protection of public safety did not suffer. Here's our court that didn't do so well. What went wrong? So everything was implemented, a risk assessment, risk need responsivity, blah, 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 everything, all the steps that we did with the other states. The judges did not see the information before making their disposition decisions. They put all the services youth were going to receive right in the conditions of probation. And then there was no room for the assessment of risk need responsivity to be effective or to even be implemented. There was no budging on the dispositions, and also this court was placing over 50% of their kids in detention or a correctional facility, and that didn't budge either. right? So I can't stress enough the importance of having the judges involved in this process. All right, those are some quick tips. And now I'm going to end with a little, just a little bit about Arkansas and Faulkner County. And I'm sure Judge Braswell is going to fill in some more. So how did this process of implementation work in Arkansas? They started with 4 pilot counties. This was funded by OJJDP and the MacArthur Foundation. They selected 4 pilot counties. Then they got everyone at the table, all of the important decision makers at the table to discuss what risk assessment instrument is going to be adopted, when do we want this to be conducted, how is it going to be shared with the court, and a whole lot of other things. The people who were at the table included the judges of every jurisdiction, every pilot site, probation administrators, the head of the AOC, the Administrative Office of the Courts, probation officers, because whatever you're putting in place has to be feasible for them or it's not going to work. Service providers. In fact, their main behavioral health service provider in the state was one of the people who was at the table. All right, what did they do? They picked the instrument. They went with the savory. The judges put MOUs in place with all of their probation officers to protect information from use at adjudication, and made sure that risk assessment was done pre-adjudication. They developed tools and procedures to improve the information sharing, so the judges were getting the same kind of information regardless of what probation officer was completing the instrument. They also refined their data system so they could track outcomes and how well this was going to work. Here's an example of a template for information being shared with the court that follows the risk need responsivity. This is what they use in Arkansas. I'm sure they'd be, I can't say I'm sure, but they may be willing to share it. Anybody would like. So it follows risk principle. What's the risk level of the individual? What are the primary dynamic risk factors that are priority in this case? Based on that assessment, what did the screening show? Might they have a behavioral health concern that needs to be evaluated? So substance use or mental health symptoms. What's the disposition recommendation? And most importantly, what are the recommendations about how you're going to address, or what does the community have that could help address the priority risk factors that the youth is presenting with? And it's rarely would they ever give more than 3. Okay, that helped a lot. I think that standardization helped a lot. I want to show you the evidence for Faulkner County because frankly, it's one of the best counties it is the best county I've ever worked with in terms of their outcomes. So as you see, Judge Braswell saw every savory, not the savory itself, but the information I just showed you. He was very bought into this process from the beginning. As you can see, they had a significant reduction. Again, this is that quasi-experimental design where we're comparing apples to apples, kids who were processed before the savory went into place to kids who were processed after it went into place. Significant reduction in probation, significant increase in the number of cases that got dismissed. One reason for this, sorry, that's backwards, is that they discovered 50% of their kids that were getting referred to the court were low risk. Okay. Not a lot of high risk getting sent there. This is typical. I want to say that again. This is typical. This last graph here, what I'm showing you is how well this county matched the services to kids' actual risk factors. It's the best matching process I've ever seen. If you look at the disruptive behavioral area, almost 74% of those youth got a service to address that kind of issue. This is better than any study I've seen. I'm just going to say that again. Mental health was also still being addressed, but they weren't doing mental health in lieu of addressing other risk factors. You can see the attitude area, 69% of those youth were getting some kind of service to help adjust their attitude around offending and criminal behavior, offending and delinquent behavior. In addition, I'm almost done. They did not reduce, they had only 2% of their youth going to any kind of placement at their disposition, only 2%. We're not going to decrease that. When they put the risk tool in place, that did increase because they were identifying high-risk kids earlier. And then when they looked over the course of their supervision, they significantly decreased kids ending up in placement while they were on probation. Okay. And probably the biggest take-home message here, they decreased recidivism. So they cut their recidivism in the course of a year and a half. They cut their recidivism for any kind of new offending substantially from 19% to 6%. And their violent petitions always stayed low. They also cut their violations. So I'm going to wrap up with a couple practical tips for judges based on what I just said and then turn it over. So one, ensure your probation office is getting you the information you need early to help inform your decisions. Risk assessment does not dictate your decisions, obviously. We all know that, but it can certainly provide some valuable information. That's number one. The second tip that I would have is try to have this done as early in the process as possible. All right, that's it for me, and I'm going to hand it off.
Thank you, Dr. Vincent. That was really helpful. Judge Braswell, after hearing such glowing reviews, can you please describe your experience with the Savory and Faulkner County, the policies, practices, and culture of your court that made it successful in your jurisdiction? And then also interested to hear kind of what the state has done to expand risk need responsivity since the original implementation.
Yeah, thanks, Josh. I appreciate the question, and I certainly want to thank today's host for inviting me to participate in today's discussion. And it's a topic that over the last 10 years that I've grown to enjoy very much. And so what I would say is Dr. Vincent just presented a lot of information that when you hear and you think about how could this impact my community, how can this impact the court system that we operate in, you got to think, yeah, I want that. I want those outcomes in my community. And so the real key is how do you make that happen? And I think the first thing is you have to say to yourself, what am I willing to do effort-wise and work-wise to obtain those results? Because I'm a firm believer that if, especially for judges, that if you provide the appropriate leadership and you're committed to achieving these outcomes, not chasing numbers, not chasing statistics, but chasing real change in kids' lives, it will work. It is hard work, and we have certainly met our obstacles, but that leadership is important because anytime that you have hard work in any industry or field, there are going to be plenty of opportunities to quit. And I just have to think that in your courts and in your communities, your kids are worth fighting for, and your community is worth fighting for. And so I remember when I was asked to be involved as a pilot court, I'll be honest, I had no idea what I was getting myself into, but I was intrigued because I knew in my first year as a juvenile court judge that something wasn't right, that there were too many kids coming into court, kids that I just got the feeling, why is this kid in my court? Why is this kid facing the issues that they have, and what are we willing to do about it? And so Dr. Vincent mentioned kind of one of the first roundtable meetings that we had as a state, and I'll remember this very well. We were going out around the room and talking about, could this work? And I had a colleague from a different area of the state that somewhat mocked my enjoyment and intrigue in this issue. And the question was this: what percentage of kids and families do you really think are going to come and sit down and bear all? What kids and families are going to come in and be honest about sex abuse in the home or in their past, the availability of drugs in the home, the physical abuse? And I asked her, what if it's only 10%? That's a small number to me. What if it's only 10%? Are we going to sit around this table and say that that 10% isn't worth fighting for? And what I will tell you is that it's not 10%. And if you talk to my probation officers who are certified master trainers throughout this state, they'll tell you sometimes in those interviews when they're going through these tough issues that families have experienced, there are times that they have to go, oh, okay, we get it. Too much information. And what we've noticed through that is that kids and families are thirsty for someone to come alongside of them and not judge them based on what they've been through, but have a better understanding of their life experiences and a better understanding as to why they're standing in court in front of a judge. And so it matters what happened, the offense that they're in court on, it certainly matters. And you'll never hear me say anything other than that. But in so many cases, the real question is why? Why have you ended up either in jail or in court? And what we've got to do is identify the areas in your life and the areas in your family where you need help. And that's why this cookie cutter approach doesn't work. There's a reason that we're seeing the high numbers. And I'll tell you just to show you that there's the proof is in the pudding. My first year as a juvenile court judge, I took over a docket and we had 685 delinquency petitions filed in my court. And my court is in Faulkner County. If you're not familiar with that in Arkansas, we're about 30 miles north of Little Rock. So central Arkansas, several colleges in our community and a fantastic community. 685 delinquency petitions filed. Since the implementation of this risk assessment and our commitment to better outcomes for kids and families, at the end of 2024, we had 162 delinquency petitions that were filed. And I'll never claim to be a math expert, but that's around 75 to 76% reduction in cases coming into court. And I've had people say, well, Judge, it sounds like what you're doing is just kind of, oh, that's not that big of a deal. That's a low rate misdemeanor. There's no reason that you need to be in court. I'll send you home. That's not at all what we're doing. This is never about being soft on kids, but we certainly have a responsibility to be smart in the way that we handle the kids that come through our court and that we develop an appropriate way to handle each case and to meet kids and families where they are. And sometimes that's a dark place. And there are a lot of kids that come into my court with pain, just like your courts. You experience the same thing. And for a lot of you that maybe have been in probation or been in the court system for a while, or you haven't implemented this or seen these type of assessments used, sometimes you'll have a kid on probation and 6 months into probation, you go, oh my gosh, if I had only known about these traumatic events that had happened to you in your developmental years, I would have had a completely different approach, not only in the way that I talk to you, but in the way that I support you, the way that I hold you accountable. And I'm a firm believer that every kid and every family is unique, special, and different. And while kids may have similar experiences and backgrounds, the way that they handle those, the way that they process those is different. And we have a responsibility as a court system, and especially as judges, to acknowledge that, to make sure that the kids that are in front of us and the families understand this judge actually cares about our situation and is willing to implement services and programs. And let me tell you, there are 10 kids sitting over in my juvenile detention center right now. There are 5 that are charged as an adult. I look at that list every day to make sure that that decision was still the right one. There's one person in this state that can take their freedom away, and that's me. That's a heavy load. And we have a responsibility. I mean, in schools, we have individualized education plans because we get this. So in court, we have to have an individualized court program for each kid and family that comes in. And I told them, I'll tell you, full disclosure, everyone, we had a meeting before this. I'm short on time. I could talk to you an hour and a half about these things, but I'm afraid they'll cut me out. So let me just jump forward real quick. As judges, you have to lead. That means that we have a responsibility to go out in our communities and find the civic programs and organizations that are willing and ready to serve in any way that we can find. It is frustrating. I used to be the chair of our Youth Justice Reform Board in the state of Arkansas and currently serve on our Supreme Court Commission for Youth and Families. And I routinely hear jurisdictions say, we don't have any resources. And the reality is you do, but you have to be willing to lead and go find them and find partnerships. And so it's one thing, ladies and gentlemen, to know what a kid has been through and through the risk assessment to understand their areas of risk and areas of need. But then what? It's our responsibility to go out and find and to implement validated services that specifically address these risk factors and needs. We certainly don't have a crystal ball. We don't know how cases are going to go, but isn't every worth kid fighting for? Isn't every family worth that extra work? And so when we implemented this, I met with my probation officers, and I speak to probation officers across the state. It's a hard process. I'm not going to sugarcoat it. When we started this process, these interviews and the entire process of completing this 2, 3, 4 hours at times to get this done. And I told my staff, we're doing this. And if you have constructive criticism or tips for a way for us to do this better, I'm all ears. But I'm not going to listen to this is hard and I'm not willing to do it. And so if you're not willing to engage with me on this, if you're not willing to go out in the community with me on this issue, now's a good time to leave, because we're doing this because it matters. And you've shown just in the numbers that I gave you earlier that it's working. Our commitments to the most secure confinements in my area are down about 50%. Our number of kids going in jail, extremely down, sometimes up to 75%. It works if you're willing to engage. And we have to be willing to do that for our high-risk youth. There has to be an alternative to the most secure confinement every time. We can't just have the same answer every time. We have to be willing and engage. And so I know that my time to answer this question is running out. And so I'll just say this. I'm fortunate to have colleagues in this state that see the value of this hard work and determination and going out in the communities and serving. It's working. We're keeping kids out of court that don't need to be in court. We're giving families, the parents that are willing and able, the resources and the tools to do what? To parent. The biggest program that works in my court is a willing and present parent. And we have an obligation to serve them and hold them accountable, but give them the tools that we need. So as a state, Josh, you asked about our state. As a state, over the last 10 years, we've had legislation passed that created or allowed the use of these validated risk assessment tools. We've modified our ability to commit kids to our most secure confinement. We do not allow misdemeanor commitments without the use of a validated risk assessment tool, and never do we allow a low-risk misdemeanor youth to be committed to our most secure confinement. And then in recent sessions, we have increased diversion opportunities and funding for those programs across the state.
Thank you, Judge. That was really wonderful and inspirational to hear. Kind of building on what you said, as we worked with courts around the country, judges, like other stakeholders, are facing increasing pressure from policymakers and others, given concerns around youth crime and youth violence, more rhetoric than kind of ever before about the need to hold kids accountable. I don't know whether you've faced those pressures in Arkansas or not, but either way, can you talk about how your reliance on the Savory and assessment tools and research-based practices kind of helps you stay committed to what you know works for public safety?
That's a great question, Josh. And certainly there are jurisdictions across the state that are kind of facing that pressure. And let me just say this, I don't want to confuse anyone. It's important that kids and families are held accountable. If we're soft and ignore what's going on, all we're doing is kicking the can, and we're creating a more explosive situation in the past. But we can hold kids accountable and at the same time give them the tools necessary to remain at home and remain in the community. And that's why I wanted to be very clear. There are kids that are at our most secure confinement that came from my court. There are kids sitting in my juvenile detention center right now. But we have to make sure that we're using that in an appropriate way. And the way that we do that is by, again, identifying those areas of risk and areas of need. But we also have to show an ability to relate to the kids and families that are in front of us. We have to be willing to help kids and families that, you know what, maybe they don't deserve it. I had a high-risk youth that had previously been to my most secure confinement, and he was in front of me right before school started. And one of the things that I always ask every day, every case, do you need anything? Is there anything at all? I don't care if it's a backpack. We bought a kid a bike one day because he wasn't going to school, and we figured it out. I said, if I buy you a bike, will you go to school? You know what? He went to school. And that's because we're engaging in the community and finding people to help kids and meeting them where they are. And I'll tell you, it's just what a coincidence. He stood in front of me not 10 minutes before this started. He successfully completed probation. He has a job. He has his driver's license. He's in school with A's and B's, and he looks great. And I asked him, you've been through a lot, and I bet you there were days you didn't like me. What have you learned as you have basically grown up in front of me? And he said, I need to treat people with respect. Because if I don't treat people with respect, they're not going to respect me. I have to be willing to go to work. Our job is done. I can't predict what's going to happen to him going forward, but I know as he walked out of the courtroom today that he was in a better place than he was when he came into my court 2.5, 3 years ago. And Josh, the last thing I would say is this, is that just as I think stories sometimes are the best way to be able to communicate the real impact that this hard work and dedication does. But I had a young lady that came in for a school fight, and it was a pretty serious fight, and she was about 14 or 15 years old, and she came in, and I was probably pretty upset that day. School fights were getting on my nerves a little bit. It was violent in nature, and it would have been very easy for me to lash out and to immediately give her what the expectations are, to tell her what she did was incorrect, that she's got to work on her anger, she's got to modify her behavior, she better get it right or else. See, I took the time and the hard work to read the risk assessment. And what I learned right before disposition is that a few years ago, she and her younger siblings were in a car wreck with her mom. They got out, her mom didn't. They watched their mom burn to death. That conversation was totally different. I didn't excuse what she had done, but I prepared her for what life was going to be like coming up when she walked out that door. And I made a promise to her. If you'll give me good attitude and good effort and be committed, we will stand shoulder to shoulder with you every day. She never came back because it works.
Thank you, Judge. Dr. Vincent, that's a great segue into question for you around when judges have a high-risk youth in front of them. What are some of the things they should be thinking about when it comes to their risk assessment or risk need responsivity or risk of violence in terms of helping to guide those disposition and service decisions that Judge Braswell's been speaking of?
It's a high-risk youth, so thank you, Josh, and that was wonderful, Judge Braswell, thank you. Good to hear you. So if it's a high-risk youth, I would hope that whoever is providing you with the assessment information has also provided you with what are the biggest risk factors for this youth. And by biggest, I mean, where do they score the highest on the instrument that they use for their assessment? But we also teach probation officers not just to look at those scores, but also to look at the research that I presented around what risk factors matter the most with respect to predicting violent recidivism, especially even after involvement with the justice system. And so I would want to know, what are those priority areas for this youth? What got this youth in front of me? Just like Judge Braswell was talking about with a girl that he had in his court. And then you're asking yourself, and hopefully again, a probation officer would be giving you some suggestions around this. But then you'd be asking yourself, are these risk factors something that can be addressed in my community right now? So for example, if it's attitudes that condone violence, or if it's disruptive behavior problems, do you have a provider that is doing some kind of CBT based service? Do you have providers that are doing evidence-based practice? Those, if so, those can certainly be managed in the community. And I'm sure that there's other providers who may not be doing that, who have kind of grassroots sorts of services that may well work. I just can't speak to them because I can only speak to where the evidence is. So that's the first question I would ask is, do I have the services in the community that are going to address these risk factors that this youth is presenting with? And if not, then you're wondering, do they need to go into some kind of residential placement? Hopefully this is the minority of youth. As Judge Braswell said, he only has 10 in detention. And make that disposition for as short a period as you can. So that, or allow for there to be a reassessment that would help that youth get discharged when they're ready to go. These sentences of youth that are long-term, there's really no basis in adolescent development or in science for those being effective. Long-term, well into their adulthood. I understand that legally there's policies around that, but there's just, it's not supported by what we know about youth and their offending. Does that help?
Thank you. Judge Bradwell, one of the things Dr. Vincent pointed out is the importance of having services in the community that actually match the kids' needs. And you spoke a little bit about the leadership that you took on in terms of identifying services in the community. You've also spoken a little bit about how you interact with young people. Can you talk a little bit more around what you think the role of the judiciary is when it comes to working with high-risk kids, whether that's in the courtroom or outside the courtroom?
Absolutely. Thank you, Josh. One of the things that I touched on earlier is going out in the community and finding, organizations or folks that are willing to step up and serve. And certainly every community is going to look different. One of the things that we're blessed with is several universities. And so we've partnered with the University of Central Arkansas, where somehow they let me graduated. So I certainly appreciate them. And so they have different programs, learning service programs that we've worked with. They've developed a program that accompanies and adjoins our juvenile drug court program, where they provide job training, those type of things. We have other classes that will come in and evaluate court systems and make recommendations on different programs. We also have a boys boxing program through that university. A gentleman that has received a ton of awards, but just has a passion to work with kids. And so people will say, you teach kids how to fight? Say, no, we take fighting kids and teach them accountability and restraint and self-control, and then also constructive criticism. So they'll go through some different exercises and they have to listen to their partner say, here's some things that you could do better. And then they switch roles. And so we're building them up. They're not learning how to fight. They're learning how to live. A lot of our kids that come into court, they need exercise. They need to get up and get moving. And so we have another martial arts class. And that just took us, me speaking somewhere, and the guy that owns the place coming up and saying, hey, we'd like to help. And so we try to engage in those different areas. I've partnered with a good friend that has a passion for youth, and he created a nonprofit called Deliver Hope. And we refer a lot of our kids to their services for sober support, juvenile court, justice circles. We really try to focus on restorative justice. We've committed a wrong. What do we need to do to make the community better? We've created and had validated kind of what we call a Juvenile Court 101. It's a 6-week program where we teach kids about being involved in the court system. How do you stay out? We have prosecutors and defense attorneys that come in to speak to them about that. And it really engages the parents. We started a Girl Scout troop. We partnered with Girl Scouts of America. To our understanding, it had never been done in Arkansas or in this part of the country. And we just contacted them and said, what would it look like if we gave young girls that have never even heard of Girl Scouts outside of cookies, I guess, an opportunity to be involved in an organization in their community and maybe do something that they didn't otherwise feel like where they belonged. And that's been a huge success for us to see these young ladies. And when they get done, they have a presentation. And one of the things that they do is they come up with ideas for different ways to support other kids that are in our community. We have an art class. So many kids come in to court and they express themselves through art or drawing. We've had local poetry nights at a local coffee shop where we go in and meet the owners and talk to them. And then we have these kids and families come in, and these kids are brave enough to get up and share these things. These small things work because we understand the outlets that each kid has. And so it's a lot of hard work. That didn't happen overnight. And so I'm a big believer in, hey, if this doesn't work, that's okay. We'll admit it didn't work and we'll try something else. And so it's a constant deal. And so, but it does take going out in the community, engaging. Your local chamber can be involved, especially from a monetary position to support that. We offer tutoring. We get college students from our universities to come and provide tutoring. And yeah, we provide food too. So every once in a while, I'll sneak down there and grab some pizza. So I won't go on, but you have to have these things available where you don't have anything to offer. And so that's what we're really trying to do by engaging our community, is to have buy-in, right? And that's what the kids see. That the kids see that their community is buying into them. Now they belong in their community, and they don't want to hurt their community because it's supporting them, and they feel that support. And so that's all we're trying to do through that.
Really appreciate those comments, Judge, because as Dr. Vincent's research pointed out, service matching is so critical to recidivism reduction. And often when we work with states, one of the most common concerns that we hear from judges is the lack of services to refer kids to. But your comments just show how powerful it is when the judiciary takes a leadership role in actually identifying those community resources. So there are opportunities for that service matching. One more question for each of you, and then we've got lots of questions in the chat. So same question to both of you, starting with Dr. Vincent. If you could give judges and other system stakeholders like your top 1 or 2 strategies for how to implement risk need responsivity and risk assessments in their courtroom and their jurisdiction, what would be kind of the key thing or key starting place for them to focus on?
Top number 1, which we found is one of the most important implementation facilitators or barriers in every one of our studies, is that the judges get the information prior to their disposition decision. That's number 1. And, many states have opted to do that risk assessment pre-adjudication to make sure that happens so they don't have to bifurcate the hearings in order for it to happen. I would never recommend that without appropriate protections of information in place for the youth, obviously. But that's number 1. The earlier the instrument is done, the better. Using it for diversion decisions, and that's where the DAs come into play. And so keeping the DAs on board with this whole process, making sure you have their buy-in, making sure that you're working together with the DAs is critically important too. Number 2, can I give 3? All right, thanks. Number 2, which is something that we saw in Faulkner County, have a very strong probation supervisor or probation administrator who is coaching and evaluating the quality of the probation officer's work and their case plans and the recommendations to the court. I cannot underestimate the importance of that enough. That's critical. And lastly, obviously, if you're in a community that is well resourced and you've got good relationships with those service providers, that's going to be huge too. So using a risk assessment to show what are the biggest needs your kids have to advocate for those resources in your community is one step towards getting them. And I will say Faulkner County has a very nice array of providers who are heavily engaged in this process. So those are my 3.
Thank you, Dr. Vincent. Judge, same question to you.
I think what's important for implementation is buy-in. And I think that, and I keep harping on it, the results that we've seen are not because I'm some great person. The results that we've seen is because we have a great community. and that we have people that are willing to step up and serve, that we have providers that are willing to engage. And I think you also have to, again, meet parents and families where they are. I have a probation officer who's she's now my intake officer. Her son went through my court years ago, and she applied, and it made me nervous. Like, why do you want to work here? This is nervous. And she said, you changed my son's life, and now I want to give back. And so we have these parents that come in, especially moms that are struggling, and they don't have anybody to talk to. And so we started a mom support group, and that probation officer, my intake officer, she leads that support group. And so again, it's leadership through engagement in the community. It's meeting the families where they are. And the last thing, it's been mentioned, and this is very vital. The relationship with your DA or prosecuting attorney, whatever terminology you use, is vital. And I think it's important because they're the ones that are under a lot of scrutiny and pressure about accountability, right? We talked about that, and punishment. I'm fortunate to have a fantastic relationship. I mean, I came out of that office when I was elected, and so I know them. They know my heart. They know that I'm not going to just turn my blind eye to serious situations. And they gave me an opportunity to prove it. And they are bought in. And so we have a teen court diversion program. Our elected prosecutor presented to our teen court volunteers, and they're going to serve as volunteer attorneys through that. And so that doesn't happen. We don't have the success that we have without buy-in, not only from our prosecuting attorney's office, but also from our public defender's office. And they've seen it work. And so after years and years of data and it coming out, they're happy to be engaged. And so I think that's a very vital step.
Thank you, Judge. I see we have a lot of questions in the chat. We're not going to be able to get to all of them, but Jessica, maybe if you can help us identify a few of them that might be of interest to everybody.
Sure. So first I want to say that we're going to take these questions and send them out to Dr. Vincent and Judge Braswell and ask them to respond to them in writing that we can send out to all of the participants post-webinar as well. Mm-hmm. So if your question doesn't get answered now or didn't get answered in the chat stream, and Dr. Vincent, thank you for going in there and doing some of that answering too, you will get an answer hopefully after the webinar. But I do want to go over a couple of them now. Dr. Vincent, one of the questions that I saw was asking about the savory. How do you get the savory? How much does it cost? All of that kind of stuff. Can you just give folks a very broad overview?
Yeah, sure. That one I did answer, but I didn't answer the how do you get it. So the publisher of the savory is PAR. Oh my gosh, I can't remember what PAR stands for now. But you can just look it up online. There's a manual to purchase. There's forms to purchase. If you want to implement it in your court, I suggest getting permission to build software for it. That's a whole other conversation around how you would do that, but that can be done. They did do it in Arkansas. We've done it with many states. NISAP provides training on the savory. There's not many others who provide training on the savory for for probation offices or probation departments. There is clinician training that is going to be available online in the next couple of months from Concept.
Very cool. And then Judge Braswell, one of the themes that came through these questions was about people who maybe weren't buying into the idea of assessment and how to persuade other judges. The prosecutor came up a number of times. How do you get those folks on board if you buy into this, but now you got to bring them all along?
Yeah, that's a fantastic question. I wish I could wave the magic wand and make that happen for everyone that's on the call. I think what's important would be is to go in with good information and come at it not as, hey, we're looking just to release a bunch of kids and we don't want to do anything, but to show the data. And if it's not working, your current system isn't working and your data looks terrible, then, I would ask a simple question. Can we reach an agreement that what we're doing right now is not working? And if I'm, as the judge or as the court, if I'm willing to lead in this charge, will you partner with me for better outcomes? and have an open dialogue and continued communication. Have them at the table. Let them know what the end goal is. That doesn't mean that you're going to agree with each other every time. And show them data where it works, and show this is the program, these are the steps that it has to take. Here's proof. And then let's go sit down, either watch a webinar, or let's go to this training, or let's go do a site visit. I have judges from all over the state. We host probation officers all the time that come and sit in court and watch court. I would love to host anybody and their staff, meet with our DA or prosecutor, and get their input. But I think it's going to them, reaching a common ground on what's not working, and trying to find a solution that you both can agree on to implement these things. I think once people see it, they're going to understand, okay, this is not what I thought it was. This actually has substance. This is not about just being soft, right? It's let's have good outcomes, but we also have to hold kids accountable, and that means that we have to make tough decisions.
I appreciate that, and I really think that you're right. That is key, right? That really is a persuasive thing for many folks. And then asking people to be at the table, and that means that you might have a lot of hard conversations while you're sitting at that table together. But as long as you're at that table, you're moving in the right direction.
Absolutely. You can't have communication, you can't reach a solution or outcome if you're not engaged in conversations. And so I would go. I mean, I'll tell you this: I'm not a data guy. I took the easy statistics class in college. I will admit that. That's fine. Okay. Funny thing is, now I'm a data nerd. It has to be data driven. And again, we're not looking for numbers, right? Because here's the thing. If we've reduced delinquency cases by 76% and we weren't doing it the right way, right, the numbers would go the opposite direction. If what we're doing didn't work, we'd have an increase of 75%. Go around and ask the youth in this community if they think that I'm a pushover. Nobody's going to say I'm a pushover, but they're going to know that I care, even when I'm giving them the toughest sanction. And so data. It's one thing to go to your prosecutor and say, we have a problem. It's another thing to say, hey, our community is smaller than this rival community. I loved it. We have 2 high schools in my community that are bitter rivals. And I love when I go meet with one, I show the other school's data and then I reverse it. Well, we don't want that school to beat us in these things. And so they see the data, then you implement things, and then you show them the second set of data. It's hard to argue with that.
All right, and we are at the end of our time, so we'll go ahead and have you answer any of these other questions that are coming in. In writing, there were some that were very specific that I'm not sure will be pertinent to everybody else, but we'll get the answers out to everybody who's interested. And Josh, I'll turn it back over to you to wrap up.
Yeah, just want to again thank Dr. Vincent and Judge Braswell for sharing your passion and your great insights and research into this work. We really appreciate it. Thank you all for joining. If you have any questions about this work, feel free to reach out to NCJ FCJ or the Council of State Governments Justice Center. Happy to help support your efforts to implement research-based practices for higher risk youth. Thank you all.
Thank you all for attending. Just an FYI, you'll be receiving an email from me, Shayna Leba, with the recording of this webinar and the PowerPoint slides, and we will be sending out the answers to the rest of these questions as well. We hope you enjoyed the webinar, and we hope you have a great day. Thank you.